So we've allowed a little bit more flexibility since we've come out of level 4, 3 and 2 alert for COVID. So during our level 1, and also because we are in a winter period which is very, very busy for the hospital, we've allowed for one person to be able to stay with a patient if the patient consents. We do want to encourage people to talk to the charge nurse about what support their loved ones might need. During visiting hours, which is 2 o'clock till 8 o'clock at night, we allow 2 people at any one time to visit a patient. And if you have children who want to visit, say, a parent, they're included in those 2 people. It is important for our families to understand that during winter, our hospital can be up to 90 to 95% full. What that often means is that wards are full with patients. Our staff are trying to provide care, particularly with very, very many unwell people. And so it actually helps us from the point of view of managing infection prevention control. So COVID isn't the only virus that's going around in winter. We're certainly looking at holding this policy in until we get past winter. And so our winter period usually runs from June to the end of September. And it certainly is one of the learnings from COVID that when we locked down the hospital and restricted the number of people going through the hospital, we did find that it was a much easier environment for patients and staff to get around. My advice to our families are that to plan ahead. The registration process that we've kept at the front door again is helpful for us to be able to contact trace in the event that we do need to find or talk to people who've been through the hospital. I certainly advise people who are coming to the hospital not to visit a patient, but because they actually have an appointment, to go straight to the front and let somebody know that you're actually here for an appointment. And those people generally can go straight through. They don't need to register because the service already knows that they're coming for their appointment. I know that hospitals can be a really intimidating environment, but it's really important that you talk to the charge nurse, let them know what you want. And if you've got lots of family who are planning to come along, plan, I'd use the word roster, organise who the 2 people are going to be in there at any one time. And if we just communicate and I just want to encourage people to keep talking to us, let us know what your needs are, and we can be really accommodating.